Hi, my name is Sarah Pirtle. Today I want to talk to you about funding for women's health. This is not only a very current and controversial issue, it is an issue that has been struggled with over the years. For many years. We've struggled with funding for this for many different services. I know right now that abortion is a big issue, why we shouldn't fund it, why the government shouldn't fund it, just because of the general morale of the procedure and many different opinions about it. Regardless, this is still a health service that still needs to be provided for women, no matter where you are. So today I want to talk about the funding that's needed for all of this. So let's say you're 21 and you're pregnant, single, alone, no spouse, no family, you don't have a lot of money, you're running on a tight ship, you don't have any insurance, and you got nowhere to go. What are you going to do? What are the types of things that you need? Here's what you need. We need access, contraceptives, cancer screenings, yearly exams, pregnancy counseling. That's number one that you're going to need if you're 21 and pregnant. STD testing and treatment, and or possibly an abortion, should that be the path that you choose to go down. So today I want to talk to you about where are we going to get these services? How are they provided? So you can go to a health clinic. They're all over. Hospitals. There's even a lot of nonprofit organizations out there. And one that's very popular is Planned Parenthood. So I want to talk to you about kind of where this all got started. First birth control clinic was founded by Margaret Sanger in Brooklyn, New York on October 16th of 1916. Now there was another American Birth Control League, and that was created in 1921. That is actually what we now call Planned Parenthood. The name was actually changed to Planned Parenthood in 1942. Planned Parenthood is a nonprofit organization, provides many different services that we've already talked about that we need. It also does research in reproductive technology, and it also advocates for protection and expansion of reproductive rights, which is very important to many people. So how are they able to do these things? Where is the money coming from? Where is the funding coming from? Well, actually, federal funding has been available to them since 1970. President Nixon signed Family Planning Services and Population Research Act, amending the Public Health Act under Title X. Now, this provided federal funding to all clinics. Over 1/3 of funding for these clinics is government grants and contracts. Planned Parenthood had $528 million in funding in 2014. But there was no funding or Medicaid reimbursements for abortions. Now, here's where we get kind of a controversy over funding later on. In 2016, President Obama administration new rule banning U.S. states from withholding funds from clinics that perform abortions. This new rule mandated federal funds for services other than abortions. Now, the day before this was supposed to go into effect, it was blocked by a federal judge. Thankfully, new legislature overturned this ruling in 2017. So now we have federal funding once again for all clinics and services except for abortions. The only exception to that rule is in cases where there is incest, mother's life is endangered, or rape. Those are the only times that they will provide coverage for this. Now, there's no Medicaid coverage and no reimbursements from Medicaid for the hospitals or clinics that perform these services. So patients have to pay for abortions out of their own pocket. So let's talk about how much an abortion costs. A non-hospital abortion costs $480. 89% of these are in the first trimester. Now, medication abortions up to 9 weeks gestation cost $504. That's quite a bit of money for somebody to come up with. Now, 31.1% of abortions in 2015 were women aged 20 to 24. Average salary for age group $572.50 per week. So that's almost one whole paycheck for an abortion. 23% of abortions are due to women not being able to afford it. Now, if a woman can't afford an abortion, what does she do? Numbers of things. She is going to have to take care of that baby. She's going to have to work and provide another mouth to feed. That's a whole nother load of stress. She can't afford it. She's not ready for it. Now, a lot of children in that circumstance, they're going to be living in poverty. They're going to be resented by the mother, possibly abuse or neglect. That's what happens to these babies when the mother can't afford to get an abortion, whether we believe it's right or wrong. So instead of doing this to the mothers, instead of doing this to the children and raising them in poor environments or forcing mothers who can't afford it, we need coverage for abortions. Moms cannot afford to pay out of pocket for abortions. We need funding. Thank you.